Welcome to MasterMined, the behavioral health business podcast. We go beyond the clinical to explore what it really takes to build, grow, and lead a successful behavioral health organization. Each episode features candid, practical conversations with industry leaders, offering strategies to scale your business while staying true to your mission. From branding and marketing to leadership, culture, and compliance, we cover the tools you need to balance care and commerce with confidence. MasterMined is brought to you by Snapshot, a digital agency on a mission to serve with heart, execute with excellence, and build something bigger together. And now, welcome to MasterMined.
Hello, everyone, and welcome back to MasterMined. I'm Jeff Skillen, founder of Skillset Enterprises, and beside me is Lee Pepper, the personality behind Pep Rally Group and the author of the new book, Never Outmatched.
Good morning, Jeff, and thank you.
Today, we're joined by someone who brings both passion and expertise to the behavioral health space, Nikki Soda, co-founder of Soda's Consulting. Nikki works alongside organizations to strengthen their operations, elevate quality, and engage in advocacy that truly moves the needle. In this episode, we'll dig into Nikki's previous membership role at NAATP, get her take on what sets high-quality programs apart, examine the trends shaping behavioral health, and discuss how advocacy is evolving. So, you have a very interesting background, and we're thrilled that you're a guest on our podcast. One of the things that really stood out to me is that I saw that you have an MS in addiction policy from Georgetown. So you clearly had something in mind when you pursued that. So how did that play out, and how are you using that now?
Sure. So it's a really good question. And one of the things that I was looking at when I've been in this field is I'm a woman in long-term recovery. So I had the personal experience with recovery. And then I started my work in the behavioral health field over 13 years ago now. And so I had the professional experience. So I had the personal, the professional. And what I was finding when I was up on the Hill was that I really wanted to have a deeper understanding of how policy works, how's policy created, but I also wanted to understand the history of it. So looking back at the war on drugs and how laws and legislation had really been created. And so someone forwarded me this new master's program that Georgetown was kicking off, started by Regina LaBelle, who was the acting ONDCP, Office of National Drug Control Policy director under the Biden administration. And so she was the director of the program, and it encompassed everything that I was looking for. And so what happened then is that I felt like I had the kind of trifecta, so to speak, of the personal experience, the professional experience, and then the educational experience, because I really wanted to legitimize my seat at the table with policymakers to say, I know what I'm talking about. And so that was a driving force to be able to have the credentials to be able to have those important conversations.
Did that actually help you become the political animal that you are now?
Without a doubt. I like that name, political animal. Don't know if I would call myself that. But what it did, Jeff, is it gave me the confidence and also I was commuting back and forth. I live in South Florida, so I was going up once a month to Georgetown, and the professors of this program are the creme de la creme of DC. And so I had an opportunity to learn from the head of NIH, the head of CDC. And so the connections and the information that I learned, absolutely.
Well, aside from you being a leader in the field, this background that we're already digging into is one of the main reasons that I'm super excited about you being on the podcast, because very few people can talk with any sort of depth or knowledge, not only about our field, but also as that overlaps into public policy and advocacy. So super glad that you're here.
Yeah, Nikki, I think one of the things that I'm most impressed with, too, besides your education, is your work with NAATP. And, there are thousands of treatment programs, in America. And one of the questions I had for you to start off was, what are some of the differentiators between the really great programs versus these programs that are kind of, that are trying to kind of move up?
Sure. So, and Lee, I know that you have experience with a multitude of different treatment centers too, of going in and seeing what's good and what's not so good. So a couple of things that I look for right off the bat, I look to see who they're credentialed by. So Joint Commission and CARF are two important ones. But I'm going to say that's not the end all be all. So just because you have a Joint Commission or a CARF doesn't mean you are a good facility. I look at who the leadership team is. By going on the website, I look to see if they have listed pictures and bios of the leadership team. And so that it's not just a blank page. I want to see who is doing it, or who is doing what and how they're credentialed. So the culture also falls with leadership, right? So credentialing, culture. I very much like to visit places that I refer to. So I know that that's not necessarily the question, but what legitimizes too, I believe, is longevity of programs. So there can be some really good startups. However, I also look at programs like Alina Lodge, Ashley Addiction Treatment Center, those that have been around for lots of years that are evidence-based. So that's another one that I want to put out. To me, that is imperative, that they have data, legit data, that's showing that they are doing evidence-based practices and not some made-up, new, trendy component. And so those would be some of the things that.
And Nikki, what's great about that is that all of those points that you listed out, I think they are accessible for all programs here in the U.S. And if you do those things, it actually then helps your marketing. Right. It helps, when you talk about pictures, I am always amazed when I go to a place and the easiest thing to look at is, well, do you have real photos or just stock photos? And, these programs, a lot of them will have stock photos. It's like, well, yeah, that doesn't really match your treatment service, does it? So if they'll match that with their marketing, with what you're trying to do, like with JACO and CARF, it'll pay dividends.
Lee, I wish that there was a regulation that said that you weren't allowed to use stock photos for facility pictures on treatment center websites. Bobby Ferguson was a big proponent of that at Jaywalker, of using actual photos of not only the facilities but the surroundings. And I can't tell you how many websites I've seen. I'm gonna use Florida. There's a lot of good treatment in Florida. There's a lot of
it's the same beach. It's the same.
Well, yeah. And I don't know how all of these programs have the same person who is forced to have their arms raised, in victory, at all times.
Well, and now we've got the proliferation of the treatment directories again. It's like we're back 10 years ago, and all they're doing is scraping those same photos.
Right. But one of my things is, do not have pictures of an oceanfront property if your facility is in a shopping center, 25 miles away from the beach. It's extremely deceptive and it's misleading. And your outsides should match your insides of what you're displaying.
As I was thinking about this episode, I mean, just the pure definition of marketing is about differentiating yourself in the marketplace. And we've already started going down this road in terms of how some programs can differentiate themselves just by being honest, by being true, and then by actually having evidence-based outcomes and then, real data. I mean, so the people who are listening to this podcast, they own programs or they think about starting programs and they want to learn from, the best of the best. And that's why I think this conversation is so critical. And so, I mean, Nikki, you've actually been in a place where you help people sort of establish that differentiation. How do you approach that?
For sure. Well, I look and see what they have existing already. And then we build from that. And so one of the things that I did while at the National Association of Addiction Treatment Providers is I visited over 100 treatment centers across the country. And so what I was able to do from that is to kind of accumulate a list of what makes what they're looking for in a good treatment center. And so with that, there's all sorts of different pros and cons. And I do have a list that people could look at and say, all right, let's make sure that we have this. Now, so there's a blueprint, but treatment centers are going to be different, right? There's not necessarily a one size fits all, although there is, kind of a starter kit, so to speak, of how to have a really good treatment center.
So is that blueprint something that you've published, or is that something that you need the secret handshake to get?
I wouldn't say a secret handshake, but it's something that I think it's important for people to know. But I also want to make sure that it's legitimate people who are looking to do it. And so there is people who are doing this work out of wanting behind science and compassion. And there's some people who are out there to do it for money. And so I, in particular about the people the company that you keep and you want to help, right?
Well, so was this formulated as you were in your role with NAATP, or was this, okay, so it was, I didn't know if it was like before, after, during.
Oh, so I apologize. So it was formulated throughout my time at NAATP.
Got it. Okay, that makes sense.
One of the things that I think, in my experience, has been like when we're thinking about JCO and CARF, there seems to be these annual events, and all of a sudden it's like a couple of weeks, before the accreditors show up, and everybody's running around with their heads cut off, trying to, oh my God, I got to get all my paperwork. And so, how do we get programs, set up with systems that they can kind of maintain, right, all these forms and the documentation, so that we don't have these annual shows where everybody's running around for a month trying to get ready?
So I am a huge proponent of compliance officers. And so I think that having a compliance officer is a critical position to have at a treatment center. And so I can hear a person saying, well, Nikki, we don't have the budget for a full-time compliance officer. And so in that case, I think it's important to have a consultant that knows their stuff in and out, that's able to ensure that you are on track, that you're doing, whether bi-quarterly check-ins of that, so that you're not in a frenzy, when it's coming time for that annual review. I think that that's very important.
I think that's super important. I think that's great advice. And I know that from the marketing side, usually when I'm working with programs on like LegitScript,
right,
I'm dealing with their compliance officer,
right,
or their the person that they've hired part time to do that. And so I think there are some ways that programs who are maybe struggling to figure out how to afford that, they ought to look at all these things that you're collecting on the compliance side will pay huge dividends in the way that you communicate your program to referral sources and to people that are calling in, direct to consumer.
Lee, you bring up LegitScript, and I think Nikki would be she would have a very interesting perspective about the creation of LegitScript and then how you think. So I would love to dig into that if you're willing, Nikki, of like not all the why it's here, but it's like, is it doing what we thought it would do? And maybe for people who are listening to us, maybe you could just give a brief description of what LegitScript is and why it's important.
Well, I'm glad I'm on my own now, so that I cannot have to worry about a powers that be saying.
Well, that's why I asked for your permission.
I'm very opinionated on this too, Nikki.
Well, this is why I ask your permission. It's like we could go somewhere else if you like, but it's like I think it's potentially pretty juicy.
So I think LegitScript, I do believe that they started out with the best of intentions, and I believe that their purpose when started had, like I said, the best of intentions. I do not believe in LegitScript anymore. This is, again, just personally. I think it is a tremendous amount of money for people I think it's a tremendous amount of money and time people have to spend to get LegitScript certified. And you have to have it, but it doesn't offer you anything. It's not offering you really anything in return. And I will say this too, and I might get ramifications from LegitScript, whatever. Their customer service, it is so challenging to talk to anyone at LegitScript unless you have a direct connection. And Lee, you have deep roots, and so you may be able to do that with treatment centers, but I've talked to a number of VPs of marketing who are like, Nikki, how the hell do I get in touch with somebody over there? Lee, have you had that experience?
Oh yeah, no, I've had your experience.
I've had your experience.
Believe
too.
me, there's no. I don't have a secret. I don't have the bat line. And I think that's where I have come with LegitScript. I think there's still a role to play, but it's like they need to really go back in and reimagine what's happened, because I think that the Googles and the Metas, they wanted something that could, wash their hands of being called before Congress, like what happened 10 years ago. So they were just
Correct.
looking for somebody to fix their problem. So now that problem's been fixed for them. But then on our side, as being advocates for patients finding good care, we are now subjugated to these directory portals now that have popped up and stolen our data and created these new programs. We're also not protected from people bidding on our brand name. And guess what?
Correct.
LegitScript, Meta, Google, they know.
Right.
They know what's going on, and we don't have anybody advocating for this, and then we're having to pay all this money and not getting good customer service. So I feel like there's going to come a time here in the next, I don't know if it's going to be a year or 5 years, but we're going to be right back in that cycle. There's going to be congressional investigations. There's going to be FTC involvement. And then whereas now we could maybe fix it now if we would just get some people to say, we've lost our way. Let's try to solve this.
And I will say, Peter Thomas is the quality assurance officer at NAATP, and he has done a heck of a job trying to advocate and have meetings with LegitScript. And at the beginning, it was very good. I have seen it go downhill from over the last, I would say, 2 to 3 years. And I know that they have had a couple of meetings and tried, but guys, what I think needs to happen is that there needs to be a conglomerate of providers that get together and say, listen, we do not want to pay this unless XYZ happens. Now, that could be my utopia thinking in this. But if you get a large group of providers that are saying, listen, there's got to be some significant changes. This is not working. Then maybe something would happen. But it's one of those things that it's like you have to be LegitScript certified, but it is a shit ton of money and time. And so forgive that expression.
Well, so let's play in utopia for just a moment, because I mean, everybody in this conversation is a pretty big thinker. And, Nikki, you of all of us in this conversation know what it takes to have these larger conversations in sort of a advocacy, public policy perspective. If we wanted to create a conglomerate, or if we wanted to create a group of people to pull things together, I mean, frankly, the three of us probably could start that if we wanted to. How would you advise us in terms of like being taken seriously and actually getting momentum and actually getting progress? How would you start that conversation?
So I would pull Nick Hayes from Cumberland Heights into this conversation with us. He has done a phenomenal job of tracking, of collecting data, and of being able to have firsthand examples of screenshots of how LegitScript is failing. Yep. And so the first thing I would do is have us get together in a room and start compiling a list of all the reasons that we've seen of the shortcomings of LegitScript. And then I would have us put together a list of what needs to change in order for it to be a more effective tool. And so from there, then I would start calling in other people to bring their list as well. And then before we know it, we could have easily 20 providers that are like, and show the amount of money that's been paid for dues. That's off the top of my head of what I would do.
Mm-hmm. All right. So in terms of, gathering forces within our industry, I agree. And I think Nick is a great place to start. And then I think we could get 20 or 30 programs that would be willing to participate. So then whose door do we knock on? So at that point, it's like, we want to talk to the manager. Who do we go talk to?
All right. I'm Karen, and I would like to.
Exactly. I love that you picked up on my joke. I love it.
I'll totally be the Karen in this situation. What I would do then is I would figure out who our best contact at LegitScript would be. And I think that we would be able to find that. And so then I would see if we could have a meeting with that person after we had all of our ducks in a row to be able to say, here's the changes that we essentially want to demand. All
right. So, you can decide whether you want to commit to this or not, but it's like, I'll come back around before the podcast ends and says, are we going to do this? Mm-hmm. And if we're going to do this, it's like, are we all going to, pinky swear that this is something that we think is really important for the industry and we're going to do it? You don't have to answer now. You've got another, few minutes to think about it.
Yeah. I think LegitScript is one of my top priorities. It is not the top priority right now.
Okay. Well, then what is?
Oh, that's a good question. Give me another second to think
Well,
about that one.
Oh yeah, no. I'm sorry, Nikki. I was just like on a
No,
trail.
that's okay. And I should know that there's a couple. So I need to process it to think which one would be my.
Yeah, no, that's totally fine.
Yeah, then let's go a different direction.
Well, I was going to say, Wendy Lee. I'm sitting here looking at Wendy Lee, and Wendy Lee, who's one of our producers. She was like, I don't think I had LegitScript written down as a question topic here.
She definitely didn't, but that's
so I
totally.
apologize, Wendy Lee. We
well,
went off, but I think it's a great conversation.
Hey, I did warn that
we
might go afield. So, Nikki, we were, to follow up on what some programs are doing to be really innovative in this space. Can you think of anything specific that's on the horizon that maybe you know of or that you've seen firsthand?
Sure. So one of the things that I think is very innovative is the way that there is a handful of treatment centers that are partnering with universities in the area. Ashley Addiction Treatment Center, for example, has a very close relationship with Johns Hopkins. And so they are utilizing researchers from the university to help do studies and to do research at the treatment center. So I believe that research is one of the very innovative ways. Another innovative way that I've seen is Karen is using GLP-1. They have done extensive studies on it and are finding tremendous success in the outcomes of being able to use that. And so kind of going outside of the box, right, of not using the traditional ways that let's say treatment centers have been for years. And so coming up with some different ways, again, though, that they know works. And so using that evidence base. So those are two examples.
Future teaser. I mean, we'll be having a guest on in the future to talk about some of the GLP. We're going to have some medical professionals that are really deep into this. So I think it is a fascinating area of research. So speaking of research, for programs that are just dipping their toe into sort of the outcomes realm, what advice do you have for them in terms of like, where do you start? How do you start? And so save them a couple of years of struggle. What should they be doing, Nikki?
So my best friend is Dr. Annie Peters, who is brilliant and does everything outcomes for FORCE, which is the Foundation of Research, Science, and Education, which is also a subsection of NAATP. And she and Dr. Nick Hayes have poured their heart and soul into developing and to working on bringing together treatment providers to utilize their data to be able to learn about outcomes and that treatment works. And so what I would do is I would direct them to the FORCE website, which has very good building blocks of how to get started. There's no cost to, and you don't have to be a NAATP provider to be part of the FORCE. It's not a study, but to be part of FORCE. And there they'll give you the tools and all the things that you need to be able to start, conduct, and to help pull together your information. So that would be the first thing that I would do.
So we will definitely put a link in the notes to this episode so that people can go find that. That is a tremendously valuable resource. So thank you for sharing that.
Absolutely. And it's done a lot of good. And so they've created a dashboard now. And so it is really showing the positive outcomes that come from treatment.
Nikki, we started off the conversation talking about, what programs are doing to kind of stay ahead of the curve. But, right now I'm sensing that we have a lot of disruption in our payer space, especially for state-funded programs. What are some things that you would advise programs to stay connected with their payer source as far as, what stands out to payers as being the key differentiators that they want to stay connected with programs on?
So say that again. The question is for what would I say to payers?
Well, right. So what advice would you give to programs who want to stay relevant to their payers? Mm-hmm.
Oh, for sure. So you need to be finding out what the stipulations and what the payers are looking for, because that has been changing a little bit.
Exactly.
And so it's not what it was 5 years ago or even 3 years ago. And so you're finding that there is a lot stricter requirements. And so I think that it is critical that you have someone. So we talked about a compliance officer. Also, a UR person, a utilization review is I feel a critical component at a critical position to have at your treatment center. You can also have a very good billing company. So that's another one that can be very helpful. But finding out what specifically the payors are requesting and needing, and then ensuring that your clinicians are all fully aware of what needs to be in treatment plans, what clinical notes need to be, because that's really what they're looking at a lot too. And I sound like a broken record with evidence-based, but you have got to have proof that what you're doing is working. And so that goes with the outcomes too, which is why that's so important, that you are, as a treatment provider, that you are pouring the time and resources you need into maintaining that you're tracking your outcomes when your patients leave, when your patients are discharged.
No, I think that's great. And the previous episode we had Sean Manis, who is a CIO, who's worked in the space for many years, and he touched on some of those. And I'm excited that we've got Ben Seymour coming up on a future episode too, where we're going to talk about, I think we're going to touch on some UR. But again, I think it's one of these positions that sometimes I go into a program and they've got somebody doing UR, but they may have been doing it for 10 years, which sounds great, but have they kept up with the changing landscape? Precisely. And have we invested in making sure they're going to the conferences, that they're going to the training? And sometimes that's where things get cut, and we wonder why is our error reports now going crazy?
Right. And it's so different from state to state too. So the payors in New Jersey can be vastly different than the payors in Colorado. And so it's one of these kind of puzzles that is important to keep up on, and it's hard to keep up on.
Well, yeah, and Nikki, I wanted to also give you an opportunity to put a shameless plug in for your consulting opportunity. How do people get in touch with you down in South Florida? Do we need to fly down to Miami or Fort Lauderdale, or how do we get in touch with you?
Very good question. And so I travel quite a bit, Lee, as I know that I know you do too. And so Soda's Consulting is something that I started based upon my several years of experience, firsthand and boots on the ground experience. And so what I really like to do is go and work with treatment centers to help support their leadership team with strategic planning, with marketing and business development. But I'm also very, very passionate about government affairs. And so being able to come in and say, all right, here is a very simple 101 way for you to ensure that you know what's going on locally within your county, within your city, within your state, and then federally. And then one of the other things that I also consult on is really getting engaged with your community. So where to look at how to elevate prevention, education, and treatment within your own immediate community. So that's something that I very much enjoy and am good at.
Do you think treatment programs stay connected with their elected officials?
No. Hold on. But sometimes
I agree.
Yeah.
I think heated agreement.
Sometimes I answer too fast. So let me. I have the importance of pause on a Post-it note over my laptop, and it does not work all the time. So there are some treatment centers that do a very good job of staying connected with their elected officials. I would say that there is more treatment centers that do not. I think that there's so much that's going on within the everyday milieu, right? You have so many different components going on that there is a lot of them that think, why the hell do I need to know, what my city commissioner is doing? Or why do I need to care what my state rep or senator does? And so that's part of the good thing about bringing me on is I understand the value and importance of being connected and letting them know who you are. Who is the CEO? If there comes a question to your senator or your representative about substance use disorder, your treatment center should be the one that they're thinking about when they pick up the phone.
Precisely.
And so that's part of what I like to do. So I would say Ashley Addiction Treatment Center does a really good job of staying connected with Maryland government officials. I also know Cumberland Heights does, and Rosecrans in Illinois. They are phenomenal with their connection of government officials. So there definitely is some good ones, but it is an area that could use some work. And I'll finish on this too. I mean, our political climate is a tad chaotic right now. And so now more than ever, it is critical that you know what is going on in your backyard, because it is going to have direct implications on your facility one way or another. So that's
I couldn't agree more, but I also believe that all politics is local. And so sometimes we're worrying about what's going on, like with RFK Jr. necessarily, but really we should be thinking about, have you had your city council, your county commissioners out to your location? Because I find a lot of programs don't, and I always believe that you ought to have a tour at your facility every single business day of the week, and they want to come out and see your program and see the work you're doing in their community.
I think the more practical reality is that a lot of people only learn about their local officials when they get a letter in the mail, or when some neighbors complain, or all of a sudden trouble lands on their doorstep, and then they've got to quickly learn how this works. And I mean, Nikki, I want to really emphasize what you said, which is lawmakers and the media are very similar, and it's like their story and their policy is only as powerful as an example they can use, right?
Correct.
So, for example, a policymaker may feel very strongly about an idea, but they're going to need to be able to say, and here's the practical application. Let me call treatment center, whoever. It's like you really want to be first call to those people so that you have an opportunity to speak about what you're doing in your community. So I think that is, I mean, table stakes to us. We understand it, but a lot of people who are listening to this podcast don't think that's necessarily a great use of their time, but it truly is.
I'll use an example too. So I did some consulting with Alina Lodge last year, and they were so receptive, and we had all of the state senators, the state local reps come to visit. And then there was an issue that did come up, and the CEO was able to get on the phone and call the senator, and the issue was rectified very swiftly. And so I firmly believe that it was, going to that point of having, it's totally different to look at a website and to talk to someone than it is to experience, especially a place like Ashley or Alina or Cumberland, where you step onto the campus and it's like, I mean, you feel it when you're there.
Yeah, and that relationship building is so critical. And then the time to build them is not when you need them, right? It's like the time to build them is when things are going well, right? And then God forbid you're ever in a spot where you do need them, you've already got that relationship. So I mean, maybe you could speak to changing people's mentality around that.
For sure. Well, you articulated it so well right there. It is so much easier to talk to someone when you're not in a mode of crisis, right? And your opportunity to cultivate. I am very, very big on relationships, as I know both of you guys are. Yep. And so being able to cultivate and to understand their needs. And I would also say a really important thing that I like to ensure that I'm talking to leadership teams about, or just people in general, is that you're hearing what your state reps and your senators or whoever your policymaker that you're talking to, what their needs are. So don't just go and say, all right, here is, word vomit about your treatment center, your policies. Like, listen to what some of their needs are. So we have found out by asking, what are you hearing from your constituents about substance use disorder? And the answers that we hear, we're able to implement some of those changes and then go back to them and say, we heard you. Here is what we've done, like, to help you. And so that's what it's about. It can't be about, all right, what can you do for me? It's got to be like, okay, what can we do for you too to help our community be better? So I think that that's an important way to look at it too, so that you're not, again, just answering in crisis or answering when you need something. Because who likes to just talk to somebody whenever they need someone? Not me.
I was explaining to a program owner this specific issue, and I said, look, I'm going to make it really simple for you. It's like if you ever need a bank loan, the time to be talking to the bank is when you don't need the money.
Correct.
Right? And so, political relationships are exactly the same way. It's like the time to build those relationships is when you don't need them. And then they're actually there when you do need them.
I wish people would do that with me, though. I feel like I get the call when it's almost too late.
Well,
Can you be here next week?
Well, see, those are the calls that I get. It's just like, if things are going great, your phone's probably not ringing, But just the idea of just a little bit of proactive planning in this space just goes so far.
Correct. I completely agree. And I am big on creating awareness and education too. So I think that that's a really important part that sometimes gets overlooked, that treatment centers are like, I don't have time. We don't need to do that. But being out in your community, providing that is a win-win for everyone.
All right, so we did sort of a 3-point turn here, but I'm going to come back to LegitScript.
Okay, good.
I just, so Nikki, you left something hanging out there that I just want to revisit. You said that LegitScript is super important, but it's not your top priority. It's maybe your second priority. So you've really got my interest piqued in terms of what is your top priority.
So, I feel like access to treatment is one of those terms that's thrown out there, but I truly think we have so many beds that are out there, but access to treatment is really access to good treatment. Let me add good treatment.
There we go. There we go.
Is really, really imperative. And it is so tough if you are not used to this space to navigate how to find good treatment and then to be able to pay for it. And so I really think that there needs to be some serious conversations about payor treatment, the way that access to treatment would be one of my number one. And so figuring out how to make treatment more affordable and how to get insurance companies to reimburse better. And so I think that probably is the biggest one, to be able to do that in order for the second to happen. So if we get insurance providers to be covering more, to be lowering the amount of denials that they are providing, will then allow treatment providers to offer more scholarships, to be able to help more people. So that's one.
Okay.
The second one is, so being a woman in long-term recovery, there is a need for more places for pregnant women to have with their children, to be able to get recovery and treatment. And so that is another advocacy issue that I wish there was more of.
Well, and I think, tying this into LegitScripts, when you have to pay the rates that we have to pay for LegitScript certification, and then we don't get the protection that we need, and then we have to spend more money than we should on marketing, that takes real dollars away from us providing better quality care or funding research or funding the compliance officer.
That's exactly where I was going to go.
Yeah.
I mean, because those dollars are scarce, and it's like, everybody would like to think they could create more dollars, but if we could get more efficient with the dollars that we have and have to spend less to regulatory agencies, that more could go towards some of these things that you're speaking of. Yes,
completely agree with that. You said a word that is, my love language is regulations, and it's just one of my love languages. But that would be another one that I am very interested in, is there has to be stronger marketing regulations. And I think both of you guys could agree with this.
Oh, absolutely.
I do not know why Joint Commission does not have a marketing standard that is prerequisites for treatment centers that they have to follow, because it is so tricky when you have a family that's in crisis, that's on the internet looking for a treatment center. It is so easy to get duped. And so that falls within LegitScript too, like part of them safeguarding, although that is not their main issue. And so having stronger marketing regulations is something that we passed a bill. We got a bill passed here in Florida. California has a bill. Texas has marketing regulations bill. However, it's the enforcement so getting the bill passed is the first really big hurdle, and then you have to get it enforced.
Yeah, because what ends up happening is the big people that we're competing with, we're not necessarily competing with the treatment center down the street. Like, I would rather compete with the treatment center down the street, but now I'm having to compete with big conglomerates that are in other states that don't follow those same regulations that I now have to in my local community. And you would think with all the technology improvements and the automation and the AI, it should be provided cheaper. But now we're seeing our costs continue to skyrocket just to protect ourselves.
Right. And we have another issue too that's coming up with AI. So people are searching for treatment centers with ChatGPT. And so now we've got a whole, it's, Dave Ehrenberg is a state attorney down here who created the Palm Beach County Sober Home Task Force. And he uses the analogy of whack-a-mole. And that's so true, where you knock one issue, another one pops right back up.
Yeah.
Nikki, it is so clear to me why you're as good at what you do, because it's like in just this conversation, we've got 3, maybe 4 sort of rallying points that I'm actually excited about trying to go marshal some forces to go take on. So
Okay.
I'm gonna come back and just say, are we going to make a commitment today? What are we going to do next? And what can we as an industry, and then what can we, we'll start with the 3 of us, but it's like, what can we do, and what do you feel like we should go after?
Yeah, so I feel that we could I definitely think that looking at this LegitScript situation, we need some associations to step up. So I'm not calling anyone out. I'm just saying that there is organizations that have a group of providers that have an opportunity to speak up, and it's not happening. And so I think that and it could be happening behind closed doors. So I think that it's imperative that we pull some people together. So I would say our first step too would be to call Dr. Nick Hayes, and for the 4 of us to start looking at, like I said before, to be looking at the list of, all right, here's the infractions that we're seeing. Here are the issues that we're hearing from other providers, and then start pulling them in, and then we go from there. That would be my action plan.
Lee, that sounds like a call to action. What do you think?
Absolutely. No, I agree.
Are you down?
Oh yeah, I've got a lot of ideas that are now going through my head. So.
Nikki, are you down?
I'm 100% down. You tell me when and where.
All right, fantastic.
That sounds like
Great.
Nashville.
All right, super.
See, so this conversation was much more than a conversation. We're actually going to have a call to action, and then something's going to come from it. Imagine that.
And LegitScript wasn't even on our agenda.
Exactly. So Nikki, as we start to wrap up this conversation, is there anything that we've not touched on that you feel like we would be amiss if we didn't address?
So I think that, so Lee, you said something. One of my mentors is Sherry Layton from La Hacienda, and she is just a phenomenal advocate. And so in all of her presentations, it's that all politics is local. And so one thing that I would like to encourage those that are listening is that everyone can make a difference, no matter how big or how small. And so I really encourage people to get involved in the things that they are passionate about, or that they really, that they love. And it can be something as little as sending an email or a call to a county commissioner, if that's too daunting. Finding a group on social media that you can make a small donation to, or at least put some purpose and passion behind. I think now more than ever, it is imperative that we fill things with kindness and the things that we love and want to grow. I think that the substance use disorder treatment centers are at we're kind of at a crux time right now. And I think that it is important that the good people are elevated and speak up and speak out to be able to continue to provide the good care that they're doing. So those are a couple of the things that I would say.
Great.
Well, Nikki, you've been an absolutely a joy and a delight to be on this podcast, and a fantastic guest. I hope it's been great for you too.
Oh, it's such a pleasure talking to you guys. And Lee, I know we've crossed paths before, but it's nice to actually have a little bit of time with you. Absolutely,
yeah. Maybe I can convince my wife to come winter down in South Florida.
Yeah. Well, and I'll be up there in October for the Cumberland Heights event. So perhaps we can see each other then.
Okay, super.
Fantastic.
All right. Well, Thank you so much.
Yeah, thanks for joining us today.
Yeah, I very much appreciate it. Thank you, guys.
Okay, see you soon.
Okay, bye-bye. That's a wrap for today's episode. Nikki, thank you so much for sharing your perspective on quality, advocacy, and trends in behavioral health. And thanks to my co-host, Jeff, for keeping the conversation flowing. If you'd like to learn more about Nikki's work, check out sodasconsulting.com. And to our listeners, if today's conversation inspired you, be sure to subscribe, leave a review, and share this episode with your team. Until next time, this is MasterMined signing off.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot. a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.